السلام عليكم ورحمة الله وبركاته. إن شاء الله starting now the first lecture of the anatomy of the CVS, the anatomy of the mediastinum. Okay. Okay, start. Yes. Today, regarding the mediastinum, we want to know the division of the mediastinum regarding its boundaries and the content of the each mediastinum. What means by the mediastinum? The mediastinum is the part or the partition or the middle part between the two pleural cavities with all its content. Like here, we have here inside the thoracic cavity, we have lung, the right lung, we have the left lung, we have two lung. In between, the space in between the two lung named mediastinum, including the heart and the vessels originating and entering the heart. Here, the heart and the content of the in structure between the two lung named mediastinum. Roughly, in structure between the two lung named mediastinum, except the lung. The lung, it is not a part of the mediastinum. The lung, it is a boundary of the mediastinum. It's clear. Regarding the boundaries of the mediastinum, yes, I wanted to draw it first. Here we have the sternum. The anterior part here is the sternum. This is the monobrum sterni. This is the body of the sternum and xiphoid process. This is anterior. This is the sternum. Sternum. Posteriorly, this is a side view. This is a vertebrae. We have 12 thoracic vertebrae, like that, and so on, till 12, from number 1, 2, 3, 4, and this is number 12. Here, we close this part from below, but what means by the diaphragm? But this is a diaphragm. And the upper part here named the inlet of the thorax, the inlet of the thoracic cavity, inlet. Yes, now it is very clear. This part here is mediastinum. This space is mediastinum, which is bounded by on both sides by the lung. I wanted to here to know the boundaries of the mediastinum. Totally, this part, all this space is mediastinum. What's the boundaries of the mediastinum? Yes, very, very clear. The anterior to the mediastinum here, the anterior is sternum. Posterior to it is, yes, thoracic vertebrae. We have 12. And inferiorly is bounded by diaphragm. And superiorly is bounded by the inlet of the thorax. Type on each side of this space will be, on each side of this space will be lung. Yes, very clear. This part, all this space of the mediastinum, I wanted to make it very simple, like I wanted to divide this space into multiple spaces. By what? I will draw a line from the junction of the body and the manubrium sterni. This junction named sternal joint or manubrosternal joint, or have another name, sternal angle, if you remember from the wrist block. I will draw an imaginary line from this sternal angle to meet or to join the lower border of T4 or between T4 and the T5. Please, this is very important, between T4 and the T5 or the lower border of T4. This line is a imaginary line from where? From the sternal angle or angle of Lewis. It is very famous, this part. This line divide the sternum, or sorry, divide the mediastinum into superior one. This is the superior mediastinum, and inferior to this line is inferior mediastinum. We have now two mediastinum, one superior and one inferior. But the heart will lie here in the inferior mediastinum, like that. This is the heart. The heart will divide the inferior mediastinum into anterior mediastinum, and behind it is posterior mediastinum, and the heart itself will be in the middle mediastinum. Again, yes, the inferior mediastinum is divided into three parts: anterior mediastinum, middle mediastinum, and the posterior mediastinum. Again, we have now superior and inferior, and the inferior is divided by the heart into three mediastinum: anterior one, posterior one, and the heart itself in the middle one. Now, from this drawing, I want to know the boundaries of each mediastinum. We start first by the superior mediastinum. Who can tell us anterior to it is? Anterior to the superior mediastinum is manubrium sterni. The posterior to the superior mediastinum is thoracic vertebrae, but not all. It is number 1, 2, 3, and 4 only. Superior to it is inlet of the thorax. Inferior to it is imaginary line. And on both sides, lung will be lung. This is regarding to the boundaries of the superior mediastinum. Who can tell us about the boundaries of the anterior mediastinum? This is space between the heart and the sternum. Anterior to the anterior mediastinum is, yes, sternum or body and the xiphoid. Posterior to it is posterior. No. Posterior to the anterior will be why vertebrae? It is anterior of mediastinum. Behind it to the anterior is the heart or the middle mediastinum. You got it? Yes. Superior is imaginary line. Inferior is diaphragm. And on each side, inshallah, will be lung. Yes. Right. Regarding who can tell us from, you got it? Middle mediastinum. What is the boundaries of the middle mediastinum which contain the heart? Anterior to the middle mediastinum is? Anterior to the middle is? Yes, anterior mediastinum. Posterior to it is? Posterior mediastinum. Yes. Inferior diaphragm, superior imaginary line, and on each side will be lung. سهلة جدا. Very, very simple. Regarding to the posterior mediastinum. The posterior mediastinum, anterior to it, the middle mediastinum. posterior to it. Yes, thoracic vertebrae from number A5 to number 12. And inferiorly diaphragm, superiorly a major line, and on each side will be lung. I think it is very clear for us. Yes. This is regarding to the superior mediastinum bounded by, this is regarding all mediastinum, thoracic inlet, inferiorly diaphragm, anteriorly sternum, and posteriorly vertebrae. And on each side will be right and left lung and pleura. We will divide the mediastinum into, by a major line from the sternal angle to the lower border of T4 into superior mediastinum above this line, and inferior mediastinum below this line, and the inferior will divided or subdivided into three parts: the anterior mediastinum, middle mediastinum, and posterior mediastinum. As we see here, this is a major line. The green color will be the superior. Then the inferior mediastinum divided by the heart into the narrow space between the sternum and the heart will be anterior, and between the heart and the vertebrae will be posterior mediastinum, and the heart itself lies in the middle mediastinum. We will take each mediastinum separate regarding to the boundaries and the content. We finished, alhamdulillah, the boundaries. And regarding the superior mediastinum, we will finish the boundaries. Anteriorly will be manubrium sterni. The posteriorly upper thoracic vertebrae from number 1 to number 4, and above thoracic inlet, and below imaginary line, and on each side two pleural cavities, or two lung on each side and the pleural. Regarding the content, yes, from this I will make the content. Please concentrate. I want to know the content of the superior mediastinum only. Very, very important in MCQ. If I draw from the above, I will see here from posterior the thoracic vertebrae like that, and all structures will be arranged or ordered in the position from the posterior to the anterior like that. And front of the vertebrae, you will see here the esophagus. Yes, esophagus. In front of the esophagus, you will see here the trachea. In front of the trachea, you will see the arch of aorta. The arch of aorta. This is the arch, which is originating from the heart. The arch of aorta give you three branches, very, very important, please. This is your right side, and this is the left side. Yes. The arch will give you the first branch to the left is three branches like that, two branches to the left of the trachea, and one branch to the right of the trachea. Please, like the same order. I drew from the same order from the left to the right like that. This is the first one is left subclavian artery, left common carotid artery, and the last one to the right of the trachea will be brachiocephalic artery. But we have three branches originating from the arch in the same order from the left to the right: left subclavian, left common carotid, left subclavian to the left upper limb, left common carotid to the left side of head and neck. Brachiocephalic will be divided or subdivided into the right subclavian and right common carotid, the same of these two left. This is regarding to the arteries of the superior mediastinum. We have the superior mediastinum containing the arch and the three branches of the arch. Regarding to the organ, esophagus, in front of it you will see the trachea. What else? Yes, you will see also the veins. The veins. You will see above the arch of aorta one vein crossing in front of the arteries like that, and above the arch of aorta unite with other artery or other vein from the right side here to forming vein. This is very important for me. Left brachiocephalic vein. This named the left brachiocephalic vein, like that. It is superficial to the arteries and above the arch. It is unite with the right brachiocephalic vein, and forming last superior vena cava. Again, veins. Yes, يبقى left brachiocephalic vein unite with the right brachiocephalic vein, forming the superior vena cava. This is regarding to the veins of the superior mediastinum. طيب, what regarding the nerves? You will see nerve? Yes, I will see the nerves. I will see here the nerve like that here, and also one here, and one here, and one here. Yes, this is the left vagus. Left vagus. This is the right vagus. This is the right phrenic. Phrenic, what means by phrenic? يعني supplying the diaphragm. And this is the left phrenic. This is the most important nerve you will see in all mediastinum, vagus and the phrenic. In the superior, you will see all four nerves: two superior, two right and the left vagus, and right and the left phrenic nerve. Please here, the vagus, left vagus only, give a branch below the arch of aorta and ascending up between the trachea and esophagus. This nerve named left because it is originating from the left vagus, recurrent, يعني recur or return back or and ascend up, laryngeal nerve, left recurrent laryngeal nerve, originating from the left vagus. Also, we'll see lymph node, tracheobronchial lymph node, mediastinal lymph node, and we'll see here lastly to the sternum and also sympathetic, yes, sympathetic chain. You will see it, sympathetic chain, and also thymus gland here. You will see behind the sternum, thymus gland behind the sternum. This is regarding roughly to the content of the superior mediastinum. Please, that is very important for OSPI also. Very important for OSPI to know what is the name or identify the arteries, nerve, and veins. Trachea, esophagus, arch of aorta, three branches of the arch, and the two veins forming the superior vena cava, right and left brachiocephalic vein, and four nerves important, two vagus and two phrenic and the sympathetic chain you will see. And lastly, and the left recurrent, we have here 6 nerves, two vagus, two phrenic, left recurrent laryngeal nerve, and the sympathetic chain. And behind the sternum, you will see the thymus gland. This is regarding to the content of the superior mediastinum. Esophagus, trachea, arteries, arch of aorta. We have arch of aorta, 3 branches from the arch: brachiocephalic, left common carotid, left subclavian, and veins, right and left brachiocephalic veins, the superior vena cava. Yes. The remnant or of the thymus gland, the nerves by vagus and phrenic, recurrent, and so on. This is regarding to the content. This is the vertebrae. In front of it, you will see here the esophagus, then trachea. Then you will see here vagus nerves, and here this is the aorta and the 3 branches of it. And this is the superior vena cava by the union of 2 veins, and lastly thymus gland and the sternum. Yes, lymph node and the thoracic duct. Here you will see here, the yes. Who can identify this vein? This is the stem of OSP. Yes, this is the left brachiocephalic vein. Unite with the right brachiocephalic. This is a superior mediastinum where you will take here a imaginary line here like that above the heart. But this is the superior mediastinum. Superior mediastinum containing the arch of aorta, and the arch will give you from the left to the right, left subclavian, the left of the patient, not the left of you. Yes, the left of the left subclavian, then left common carotid, then brachiocephalic artery. And the brachiocephalic artery itself will divide into the right subclavian and the right common carotid. This is the left brachiocephalic vein unite with the right brachiocephalic vein to form the superior vena cava. This is the trachea, which is like the ring, like that. You know the trachea by the cartilaginous ring. Cartilaginous ring. Yes. This is the left brachiocephalic vein, right brachiocephalic vein forming the superior vena cava. This is the arch of aorta. Okay. This is the organ behind the trachea. We'll see like a tube, brown in color like that, named esophagus. Esophagus behind the trachea. Behind the trachea. The trachea is anterior to the esophagus. I think it is very clear. Regarding to, we finished the superior mediastinum. Regarding to the anterior mediastinum, the boundaries we know. The anterior mediastinum, it is bounded, or it is a space between the heart. Anteriorly will be the sternum body and the xiphoid. Posterior will be middle mediastinum or the heart, and above the major line below diaphragm, and on each side you will see the lung and the pleura. What is the content of the anterior mediastinum? It is very easy, like here. It is lymph node, thymus gland, and the sternopericardial ligament. Like here, if you see here, you will see here the between the heart. This is the anterior mediastinum. We'll see here lymph node, and also we'll see here thymus gland, thymus, and the two ligaments between the heart and the sternum, named sternopericardial ligament. Yes, the brachiocephalic, not named right brachiocephalic, named brachiocephalic artery only. Will give you the right common carotid and the right subclavian. Yes, between the heart and the sternum, you will see here two ligaments stretching between the heart and the sternum, named sternopericardial ligament. Sternopericardial ligament, one superior and one inferior ligament. It is very important for fixation of the heart regarding to the sternum. Okay, this is regarding to the anterior mediastinum. Regarding to the middle mediastinum, we finished the boundaries before. The anterior, which containing the heart, or contains the heart. Anterior to it, anterior mediastinum. Posterior mediastinum, major line above, diaphragm below, and on each side you will see the lung and the pleura. What is the content? Yes. The content of the middle mediastinum will be the heart. The first structures will be the heart, and the heart is have 4 chambers, 2 ventricles, and 2 atria. This is the right atria, and this is the superior vena cava. Go to the or enter the right atrium. This is the inferior vena cava. This is the right ventricle. This is the left ventricle. This is the left auricle. Yes, the right ventricle here will give you the ascending aorta. Here AA mean ascending aorta. The left ventricle, I'm sorry. Clear this. Yes. Again, the right ventricle will give you the pulmonary trunk. pulmonary artery or pulmonary trunk, which go to the lung to oxygenate the blood. And the left ventricle will give you the ascending aorta. لا يبقى here the content of the middle mediastinum very very easy, containing the heart, and the heart is covered by pericardium. You know pericardium, and the all vessels entering and go inside the heart, like the superior vena cava, inferior vena cava, pulmonary veins, ascending aorta, pulmonary trunk. All these structures will be here. And please don't forget, you will see here two nerves, very important, is the descending like that on each side of the heart. Don't forget, on OSP, it is phrenic nerve, right phrenic, and posterior to it هنا will be inshallah left phrenic. The right phrenic and the left phrenic, one on each side of the heart. The vagus nerve not here related to the heart. The vagus nerve will see inshallah back to the heart on the posterior mediastinum. The content of the middle mediastinum will be the heart and the pericardium, the vessels originating from the heart, ascending aorta and the pulmonary artery, and the veins, superior vena cava, inferior vena cava, and the pulmonary veins, and the phrenic nerve, and the lymph node. Yes, the trachea. We see in the superior mediastinum trachea and esophagus. The esophagus will be in the posterior, but the trachea division. Bifurcation here means the division of the trachea we'll see here in the middle mediastinum and the lymph nodes. Yes, here, this is regarding to the heart and the pulmonary trunk originating from the heart, ascending the aorta, ascending, not on the arch. The arch will be in the superior mediastinum. It ascending first as ascending aorta, then will make arch, then continue as descending aorta. This is the content of the middle mediastinum. The last one is the posterior mediastinum. We finish the boundaries of the posterior mediastinum. What is the content of the posterior mediastinum? Yes, the content of the posterior mediastinum will be esophagus, because esophagus will go through two structures. The first organ you will see here is esophagus. Esophagus. And the esophagus, there is a narrow tube run with the esophagus named thoracic duct. Thoracic duct. It is lymphatic. Yes. And the most important artery here is very long one. Yeah, this is a descending aorta. Here each mediastinum contain a characteristic part of the aorta. The middle mediastinum containing the ascending, the superior mediastinum contain the arch, and the posterior here containing the descending aorta. Because the aorta like that. This is the arch. This is the ascending our aorta, and this is the descending aorta you will see here in the posterior mediastinum. The nerves, yes, the nerves here you will see it is make a plexus around the esophagus. This is a vagus nerve. You will see here in the posterior mediastinum, vagus nerve or sympathetic plexus of vagus or esophageal plexus of vagus nerve. And also you will see here the sympathetic chain because it is near the vertebrae, sympathetic chain. And also two veins, if you remember, azygous vein, azygous and the hemiazygous. We talked it before in the resp block. You will see here in the posterior mediastinum. This is regarding the content of the posterior mediastinum. Descending aorta, esophagus, thoracic duct, and the azygous and the hemiazygous. Please don't forget vagus nerve. The vagus nerve will see in the posterior and the superior mediastinum. And the sympathetic chain you will see also in the superior and the posterior mediastinum. Phrenic nerve you will see in the superior and the middle mediastinum. Esophagus, superior and the posterior mediastinum. Trachea, superior and the middle mediastinum. Don't forget, don't be confused. Yes, here, this is the aorta. This is the aorta. descending aorta. This is the azygos. This is the thoracic duct, which is green color. Yes, here, this is the esophagus. This is the vertebrae. This is the lymph node. Yeah. This is the bifurcation of the trachea in the middle mediastinum. This is the heart in the middle mediastinum. Yes. Regarding the nerves here, this is the phrenic nerve. Why? Because it is related to the heart on each side of the heart. This is the sympathetic chain, which is having a ganglia like the chain. This is the vagus nerve, left vagus, making a loop or a hook below the arch of the aorta to give the left recurrent laryngeal nerve. This is a descending thoracic aorta. This is a descending thoracic aorta. This is the arch of aorta. This is the ascending aorta. This is the heart. Clear, shabab? Clear? Clear? Yes, here. This is the heart and the arch of aorta. Okay, this is the diaphragm here, and the black color here, it is on each side will be lung. It will be lung. Yes. This is regarding to the heart, and the black color here will be lung. This is regarding to the content of the mediastinum. This is the relation of the supine position and prone position regarding to the heart. The heart will go to slightly up during the supine position and go down during standing. This is what means by mediastinal syndrome. It is a syndrome which is compression of the mediastinum, but by a mass, by any mass named the mediastinal syndrome. Will syndrome, compressions by tumor, by lymph node, will go compressions to the heart or the vessels or esophagus or trachea. Any of the content of the compressed of the mediastinum can be compressed by mediastinal syndrome. Clear, shabab? I think it is very easy. Clear? Any questions here? Any questions? Thank you very much. Good luck, inshallah. We'll continue tomorrow, inshallah.